I'm Dr. Brad Fanestil. I'm an internal medicine physician, and you're about to undergo a procedure from a surgical team with the most up-to-date training and the most cutting-edge technology. We want to give you the same up-to-date information and the same cutting-edge technology for pain management. We want to show you an exercise that has been shown in the medical literature to reduce pain, but also to reduce the use of pain medications. And that's important because pain medications can cause constipation, can cause urinary retention, they can occasionally cause addiction. And these are medications that have some benefits in the short term, but if we have a procedure or an exercise or a most up-to-date pain treatment modality that isn't pain medications, we should use it. And that's what we're offering you here today. A couple of years ago, I saw a study in the medical literature published in Annals of Internal Medicine, where Eric Garland, who is a PhD neuroscientist at University of Utah, had demonstrated a marked reduction in pain and in medication use from a simple intervention like this, done in hospitalized patients. And I thought that was so interesting, I went and took a class with him. The new neuroscience is that pain is a two-way street. A message comes from the body to the brain, but it's the brain that decides, is the signal dangerous? And if your brain decides the signal's dangerous, the brain's going to warn you by creating pain. So it turns out that how much pain you perceive is really determined by your brain's assessment of the incoming information, telling me that I need to get out of a situation. I need to protect my back or my stomach or my whole body in the case of anxiety. So once you realize that pain and anxiety are nothing more than alarms from your own brain just trying to keep you safe, we have a whole different set of tools to treat it. We're really just talking about a concept called metacognition. And this is the idea of stepping back from your pain or your thoughts and noticing them instead of being caught up in them. As the signal comes in, if your brain is all caught up in it, then the brain can stay like this and pain can be amplified. And this is just a simple exercise that can teach you how to step back from your pain and watch it from a different perspective. That's called metacognition, when we step out of our own experience and watch what happens. This is a script from Eric Garland. It's a little meditative exercise from Dr. Eric Garland at University of Utah, who has kindly allowed us to use this. And I'd love for you guys to give it a try and just see how it lands with you. This is a concentration exercise in metacognition. In other words, watching your thoughts. And this can help us not get so caught up in our own thoughts and can help us feel more comfortable and more relaxed. This will take about 10 minutes. Now, when ready, resting comfortably, but remaining as alert and aware as possible. Many people find it more comfortable to allow their eyes to close or just rest gently on a spot in front. In a moment, noticing the sensation of your body resting against the chair. Noticing the sensation of contact between the backs and the legs and the chair. And we have this word contact, but what is it really? A sensation of warmth or heaviness or tingling? Just noticing that sensation. And in a moment, allowing awareness to expand and fill the body. Becoming aware of the entire body in this moment. Just noticing the state of the body right now. Is the body tired or full of energy? Is it relaxed or tense right now? And it really doesn't matter. Just noticing the state of the body in this moment. And in a moment, becoming aware of the state of the mind. Is it full of thoughts or mostly empty of thoughts? Are the thoughts moving fast or are they moving slowly? And again, it really doesn't matter. Whatever the state of the mind is in this moment, it's okay. Just noticing the state of the mind in this moment. And when ready, shifting the focus of attention to the sensations of the breathing. Not trying to change or alter the breath in any way. Just noticing the breath right now. Perhaps noticing the sensations where the breath meets the body, perhaps at the very tip of the nostrils or on the lips when inhaling. Perhaps noticing the warmth or coolness of that air while breathing. Noticing the breath and noticing the part of the mind that notices the breath. And on the next in-breath, perhaps following the breath more deeply into the body. Noticing the sensation of the breath filling the lungs. Maybe noticing the gentle rise and fall of the belly while continuing to breathe. Aware of this in-breath right now. And this exhale right now. And soon, perhaps noticing that the mind begins to wander to thoughts, feelings, images, memories, or sensations in the body. And if the mind has wandered, that's okay, because that's what minds do. They wander. Just noticing where the mind has wandered off to. Acknowledging that thought or feeling, and gently bringing the attention back to the breath. Aware of the breath moving in the nostrils. Aware of the breath moving more deeply in the lungs. Fully present with all of the sensations of each breath. Breathing in and breathing out. Just aware of this in-breath happening right now. And this exhale happening right now. And whenever the mind wanders to thoughts, emotions, or sensations, that's okay, because that's what minds do. They wander. Just noticing where the mind has wandered off to. Acknowledging and accepting that thought, feeling, or sensation. Perhaps even saying to yourself, in the space of your own mind, it's okay to have this experience right now. And then letting it go. And gently but firmly bringing the attention back to the breath. And it really doesn't matter if the mind wanders 1,000 times. Because each time that you notice that the mind has wandered, and you become aware of where the mind has wandered off to, and then you gently but firmly return the focus of your attention back to the breath, you're learning to step back. To step back. To step back from thoughts and feelings and into the clear, open space of mind. And soon begin to notice that thoughts, feelings, and sensations are like clouds passing in a clear blue sky. Like clouds drifting, these thoughts and sensations come out of nowhere, gradually change shape, and then fade into the distance, all on their own. And there's no need to hold on to those thoughts or push them away. Just letting them go. And a part of the mind is like those thoughts, passing like clouds. But there is a deeper part of the mind that is more like the space in which the clouds pass. The observing awareness that is open, vast, unbreakable, and free. Just watching, just observing, peacefully. And perhaps focusing attention on that part of the mind now, or continuing to focus attention on the sensations of breathing. That's right. On the sensations of the breath flowing into the nostrils. The sensations of the breath moving deep in the lungs. And you can return when you need to this state of mind whenever you need to, simply by bringing your attention back to the breath. And then very slowly and gently, when you're ready, you can complete this experience and open your eyes.